Welcome to the Los Angeles County Department of Mental Health's monthly magazine, Meeting of the Minds. I'm Karen Zarsa-Diaz. In this month's Mental Health Minute, a study has found older adults are happier than younger ones. Researchers at the University of Warwick took a look at the quality of life and happiness of about 100,000 people in the U.S. and United Kingdom. What they found was happiness levels were lowest around the age of 45, but got better with age. Researchers believe it's because older adults have developed better coping skills than younger adults, and older adults are less likely to put pressure on themselves in their personal and professional lives. The study also showed that people who slept between 6 to 8 hours a night had higher physical and mental health scores compared to those who slept more than 8 or less than 6 hours a night. In other news, there's increasing evidence showing the importance of mental and physical health care for people who have suffered cardiac emergencies. Researchers at Tel Aviv University found changing a heart attack patient's lifestyle should be coupled with mental health support too. The study found heart attack patients who suffered from depression were more likely to be readmitted than their happier counterparts. The research team suggests doctors closely monitor patients with a history of heart attack. They also recommend patients not only receive rehabilitation services and modify their lifestyle, including diet and exercise, but also seek mental health support to combat depression. Hope, Wellness, and Recovery is our department's motto. With more about what DMH is up to, here's a message from our director, Dr. Marvin Southard.
Today, I would like to say a few words about what the Department of Mental Health hopes to do about one of the most difficult problems in American society today. I think anyone who has had some experience trying to manage the primary care and specialty care needs of someone with a serious health problem knows that keeping all of the appointments, tests, and prescriptions straight can feel like a full-time job. I know that my sister felt overwhelmed trying to coordinate all the care my mother needed when she was ill. Imagine how hard this would be for someone without a good support system and who had severe mental health or addiction issues. So DMH is trying to take the lead in creating mechanisms to coordinate the health care, positive health practices, mental health care, and addiction treatment needed by our clients. We are training health workers and people with lived experience of mental illness to learn how the care can be better integrated, as well as co-locating mental health staff at primary health care clinics and primary health care staff at our mental health clinics. All of us are whole human beings and not divided up into parts. So it is true that there is no health without mental health, and that good mental health does no good if our clients are dying early because of poorly treated health or addiction problems. Integrating services just makes sense.
Thank you, Dr. Southard. We like to share stories and tips on wellness and recovery on this show. With more about this in our Walk the Talk segment, here's Kathleen Pache.
Thanks, Karen. My guest today is Catherine Bond. Catherine Bond is one of the leading consumer advocates in California. She has worked as a therapist and English instructor and has spent time teaching in South Korea and Thailand before becoming involved in peer support and training. Catherine currently serves as the director of the Empowerment and Advocacy Division at LA County Mental Health. In terms of mental health recovery, Catherine values what works for the individual and believes in a mind-body connection. She should know she's on her own journey of hope, wellness, and recovery. Welcome, Catherine, to Walk the Talk.
Thank you very much.
You are someone that definitely does walk your talk. So what are your diagnoses or diagnosis?
Well, that depends on who you ask. But the one that seems most reasonable to me is bipolar disorder, although depending on where I am in the mood swings, I've had psychiatrists diagnose me as almost anything, which of course is a problem with mental health diagnoses. They're not as simple sometimes to decide on as some others.
How do you personally maintain your recovery?
Well, I do something called a Wellness Recovery Action Plan.
Or WRAP?
A WRAP. And I pay attention to kind of my daily levels of stress. And I enjoy life. I live as fully as I can.
What do you do when you feel like your symptoms are worsening or exacerbating?
One of the things I do is I go to a peer support group, and then if things get beyond the point where my peers can really help me, I go for professional help. I have a psychologist I consult with and see occasionally. I also have a psychiatrist.
So you have a good plan in place?
Oh yes. I used to wing it, and I found that doesn't help.
Right. There's a movement nationally and locally to treat people more holistically in terms of not just mental health, but getting medical treatment if they need it, or substance abuse treatment if they need it. Can you talk a little bit about that? Is that important to you?
Crucial. For a long time, the only thing I paid attention to was my mental health. And for me, the substance abuse was not as much a factor, and something that the Department of Mental Health is now very sensitive to, that you have the mental health and the substance abuse services integrated. And we die, on an average, 25 years before the rest of the population if we don't pay attention to health issues.
That's a lot of years.
Yep.
A lot of lost years.
I'm a survivor.
You definitely are. I know that you were homeless at one point in Santa Monica,
Yes.
and you were sort of up and down a lot, but you've
Yes.
really come through.
Well, the last 13 years, but you know, I think I'm a living proof that it's never too late.
That's exactly right. Tell me, because you are so fun, what is the fun factor of recovery?
For me, the fun factor of recovery is doing something in the community that you enjoy, and for me, it's folk dancing.
Oh, I didn't know that.
Yes. A friend of mine introduced me to folk dancing, and I really like it.
Great. When other people find out that you have been given a diagnosis, how do you cope with the reactions? What are the reactions?
Well, the usual reaction, if they haven't known me from the get-go as having a diagnosis, is, oh, well, you're different. As if it was some terrible thing that we want to assure you you're really not like that. And it's very important for me to step up and say, hey, wait a minute, I really have had some very serious issues. I've been in mental hospitals in 5 states. I've been homeless on the street for 6 months. This is not a good thing, and it's a serious thing, but it doesn't mean that I'm less than fully human, just like you.
I think it makes you more human.
God willing.
You have a new job.
Yes, I do.
As Director of Empowerment and Advocacy, which is a big job. What are some of your goals for that?
I think with empowerment and advocacy, the main thing that we want to do is reach out to people who are dealing with the things that I'm dealing with and say, we can do better if we work together.
What is some advice from you about someone who's been diagnosed with mental illness?
Welcome to the club. Don't be ashamed. You're one of a wonderful group of people, many of whom are quite interesting and quite fascinating and creative, and we are able to give back to society. We're able to do good things, and I'm very glad that you were willing to step up and acknowledge the diagnosis, and I hope we can work together.
Thanks, Catherine. You definitely are an inspiration, and you are definitely walking the talk.
Thank you, Kathleen.
Thanks for being here. Back to you, Karen.
Thank you, Kathleen. And that's the show for this month's edition of Meeting of the Minds. To learn more about the Department of Mental Health and for more information about DMH's programs and resources, you can always visit the website anytime at dmh.lacounty.gov. You can also follow us on our Facebook page and watch our Profiles of Hope videos and PSAs on YouTube. Just search for the Los Angeles County Department of Mental Health, or LAC-DMH. And if you or someone you know is in need of help, you can call our 24/7 access line at 1-800-854-7771. That's 1-800-854-7771. Thank you for watching. We'll see you again soon.